Welcome to the Cabral Concept, where board-certified naturopath and integrative health practitioner Dr. Stephen Cabral shares how he was diagnosed at the age of 17 with a life-altering illness and given no hope for recovery. It was only after studying and traveling all over the world did he discover how to combine ancient Ayurvedic healing practices with state-of-the-art naturopathic and functional medicine to fully rebalance the body and re-energize it with life. It's time to discover how to get well, lose weight, and finally feel alive again. And now, here's your host, Dr. Stephen Cabral.
Welcome back, everyone. Great to have you here on our Wellness and Weight Loss Wednesday, where today it's going to all be about the gut and the brain and how the two interact and how science is literally proving how the bacteria we have in our intestines affect the thoughts in our mind and how our mind actually affects the bacteria and digestion in our gut. So it's very fascinating because, again, the conventional medicine outlook on our overall body and mind and overall health is that everything's separated, everything's in its own specific area, and we need a specific doctor in order to be able to help us remove those symptoms. Because again, we're not getting the body better by going to a specific specialist. What we're doing is we're actually masking the symptoms. So if you go to a cardiologist and you have some type of heart-based disease, well, you're being put on a handful of medications, typically a statin and other specific-based drugs. Maybe you'll be put on diuretics, and maybe you'll go to a vascular specialist, or you'll go to a pulmonologist, or you go to your cardiologist, you go to someone and you'll be put on additional medications for blood pressure, right? So we look at that. If you have type 2 diabetes, okay, well, now you're being put on prescriptions for metformin or other specific factors. So again, if you have autoimmune issues, they're giving you biological drugs. You're always being you're blocking the symptoms, but what's overlooked is that how the gut, amongst other parts of the body, actually affect how the body works. So one of the best instances, and I did a podcast on this, so again, I'm going to always use the show notes to link back to previous shows so that we can build upon our knowledge, right? So the goal is, like, for example, today's show is all about how low mood, anxiety, and depression are absolutely linked to gut health. Like, absolutely linked to gut health. Is it the only thing? No. But we do know that people with imbalanced gut bacteria are much more prone to low mood, anxiety, and depression. So, well, what if psychiatrists or therapists looked at the gut and worked on that along with therapy-based programs? Well, now that would be the best of all worlds. So we want to take this a little bit deeper. And here's the reason why, is that you can't just go to your specialist, your PCP, and just expect them to have all the answers. They are not trained at all in any type of holistic mindset. Everything is reductionist, meaning like you come in with this on your blood work, you get this pharmaceutical. There is no time to talk to you about nutrition. There's no time to talk to you about good nutritional supplementation. There's no time for them to talk to you about exercise. There are a couple doctors that do it. It's way less than 0.1%, that's for sure. If you take all of the physicians in the United States, there's just no way that they're able to do that. And the reason is that they get paid based on health insurance. So if you're paid based on health insurance, you have specific windows that you need to fit people in, and you need to do your electronic medical record. So again, I'm not blaming conventional medicine doctors for sure. They're doing great work. Not everybody, a lot of people, to be honest, want the medication. I totally get that. But if you're listening to this show, you're at least contemplating rebalancing the body at underlying root cause issues, and you may not want to be on an antidepressant, an anti-anxiety, sleep medication, like whatever it might be, for years on end. You might say, well, at some point, I need to be able to address the underlying root cause. And that's what we're going to talk about here today, and how it relates specifically to gut-based health. So again, I'm going to link up previous shows in the gut-brain axis. The gut-brain axis is basically, it teaches you on that podcast that your brain, so think about your brain right here. I got to start bringing back my buddy Walter. I'm going to pull him back in another show right there to show you that the base of the brain, that's where the brain stem is, and the spinal cord comes up to meet it. Well, the spinal cord, we think of it as vertebrae, right? Bones, the vertebrae that run down the back and right down to the base of your basically glutes. But if you think about that, it's not just about the bones there, the vertebrae, right? It's about the nervous system. So the nervous system runs from the brain down throughout the entire body. It's innervated off of the spine. And we also have what's called the vagus nerve. So the vagus nerve attaches up to the base of the skull and it runs down to the gut. So that is think of that as the telephone. That's the transmission line. So if you are having stress, anger, depression, anxiety, etc., those signals, they don't stay up in the brain. They actually go all the way down to the gut. Now, let's think about what the gut does for a moment. Well, the gut is absorbing nutrients to help your body with repair and rejuvenation and energy. Okay. So would your digestion, repair, rejuvenation, energy be affected if your gut wasn't working as well because your brain was sending it signals that there's anxiety, that there's depression, that there's low mood, that there's anger? Yes, that is exactly correct. Why? Because it's going to halt a lot of those processes because the vagus nerve works best. Oh, I should say digestion works best when you're in the parasympathetic nervous system. That means you are literally in a healing-based state. You're in what we call the rest and relax and digest. That's where you need to be in order for the body to heal. We talked about that just on yesterday's show, the sleep-based podcast, and on Monday's show, we talked about it on how to reduce stress. So that's why each podcast is its own show every single day. And you don't have to listen to any one in particular, but if you can get them each day, then it just builds up your knowledge over time because there is no one thing that fixes anybody. And that's where conventional medicine goes wrong. Is that you get better through, again, the word holistic gets thrown around, but a truly holistic mindset. Like it's not all about nutrition, that's for sure. I'm going to be doing a show on different case studies where people have tried every different diet and every different diet didn't work for them. And then some of them worked for other people. So why is that? So I'm going to go through that. But, it's about nutrition. It's about movement. It's about sleep. It's about detoxifying. It's about the mindset, emotions. So these things matter, but there's not a million things. There's 8 specific facets, as I call it, the de-stress protocol, right? Diet, exercise, stress reduction, toxin removal, rest, emotional balance, scientifically based supplements, as well as the success mindset. But we're going to talk more about today how the anxiety and stress literally can lead to and does lead to IBS, which is irritable bowel syndrome, and IBD, which is irritable bowel disease. And honestly, it's just one's chronic and one's more acute. You can put different nuances around them, but really you're talking about an imbalanced digestive system. I was chatting with this guy the other day. He's a famous artist, and it's challenging when someone believes that everything is healed with a medication. And what I didn't realize was they didn't know that there are levels to this. That the reason why many people suffer from IBS and IBD is, one, they might have a lot of stress, a lot of undealt with trauma in their life, but also they might have an imbalanced gut microbiome like I did. So I had both stress and anger when I was younger, but I also had an imbalanced gut microbiome from taking so many antibiotics when I was a child. And so I had that coupled with the stress. So now I have a really imbalanced gut. So what was that happening? Well, think about it like this now. If we have this gut-brain axis, which we're now labeling the gut microbiota brain axis. So in medical science, keep in mind, they can't keep things simple, right? Can't call things like chronic fatigue syndrome or anything like that. We need to give it special names, okay? So for gut-brain axis, that was too simple for them. So we, I wouldn't classify myself as part of that, but the gut microbiota brain axis. So now it gets into the type of bacteria that you have in your gut can lead to bloating, gas, diarrhea, constipation, and even things like acid reflux, etc. So the way that happens, though, is not everybody has a vaginal-based birth at birth. Not everybody has a balanced gut bacteria. And if they take antibiotics or birth control or too much alcohol or too much processed food or too much processed sugar or these types of things, it can lead to a overgrowth of what's called negative bacteria or commensal bacteria. So too much bacteria that we won't call positive bacteria. That just means like overall, we want to have more good bacteria in the gut. And so what happens is we can have too little good bacteria, too much commensal or bad bacteria. But we can also have all good bacteria that we're supposed to have, but we can have an imbalance of good bacteria. So too much of the colon-based bacteria, the bifidobacterium, too little of the lactobacilli or the lactobacillus-based bacteria. And these are not like simple things to even understand. And so when you're dealing with gas, bloating, et cetera, you can't eat carbs, you can't eat vegetables, you can't eat fruit because you get bloated all the time, you get joint pain, you get skin rash, you get headaches. I get it. But again, the answer is not to avoid those. It's just no one's told you before that you have an imbalance in your gut microbiome. So then you get the bloating, you get the gas, you get the constipation, you get all of those different things. And then guess what? You also feel stressed from that. You feel anxious from that because now you can't even go out to eat. You don't know what to eat anymore. You get skin rashes. You don't like how your skin looks. And so what does it lead to? More stress. Guess what? That imbalances your gut even further. That is how this gut-brain axis works. So what do? Do we just work on the mind? No, we can't. Because just working in the mind, sure, it's going to work. it's going to be helpful. But it's not going to rebalance your gut bacteria. That's why, as much as I love acupuncture, literally, I was in India, not in India. Well, yes, in India, actually, I was doing acupuncture. A lot of people don't believe that there is acupuncture in Ayurveda. There is. They use marma points. It's very, very similar. But anyway, I digress on that topic. But when I was in China, of course, we were doing a lot of acupuncture. And I love acupuncture. But the thing is, when I was in a TCM hospital in Old Beijing during one of my internships, they never did acupuncture alone. Like, we always gave people herbal-based medicine, et cetera, along with acupuncture. Why? Because if you're trying to rebalance the gut microbiota, you're not going to do it through acupuncture alone. If you do, it's not the most efficient way to do it. That's for sure. And again, I love acupuncture. I do. But again, I just want to say, you can't just use one modality. So all of this to say that the gut, meaning your intestines, you've got about 21 to 24 feet or so of intestines. You have about 20 feet of small intestine. You've got about 5-6 feet of large intestine. There's a lot can go wrong there. And that's why you need to look for parasites, H. pylori, bacterial imbalances, and yeast. Those are the 4 big things. And then, of course, it comes with that leaky gut, which can cause massive amounts of inflammation. Well, think about it. If you have massive amounts of inflammation, what do you have? You literally have any disease that you're genetically prone to. Because inflammation is what leads to disease. It's not a root cause. The root cause might be leaky gut, right? But you want to understand that it can begin with the gut. So that's the place to start. So there is a lab test that you can run with your naturopathic doctor or integrative health practitioner level 2. You want to do a 3-day. It's a stool test. Okay, it's called the bacterial and parasite stool test. It's the best in the world for assessing those 4 things I just named. But yeah, again, you do want to run that. Now, if you can't, it's okay. Like, it's understood. Like, it's not something that you're going to be able to run through your MD unless they are practicing gut-based health and they do a 3-day functional medicine-based test. And then fantastic. Then they're part of that like 0.1%. But I wanted to go a little bit deeper because the science is pretty amazing now. And so I just wanted to share with you. So, by the way, there is a fix to all of this, okay? So the fix is, if you can, you run the stool test. You find out what your specific imbalances are. The reason I'm always recommending at-home labs is because there is no other way not to guess. I'm telling you right now, I've done this for a lot of years, like a lot of years. Work with well over 250,000 people I've overseen in my team and myself. We've seen pretty much everything. But I can tell you, and I can make educated guesses. There's no doubt about it. But it's still a guess. It's an educated guess, but it's still a guess until I've run lab work with you. Like, that's the truth. And no doctor can tell you otherwise, because you don't know which bacteria is literally imbalanced. You don't know if you have parasites. You just don't know if you have H. pylori. You don't know if you have bacterial overgrowth, and you don't know if you have yeast overgrowth. So anyway, you can also run what's called a gut bundle, and that will run your food sensitivities and another test for yeast that's pretty powerful as well. You don't have to run them through us. You don't have to, but at least see what they are. You can go to stevencabral.com/labs, check them out. And again, you can run them with us, so you can run them with your local naturopathic doctor or integrative health practitioner level 2. But let me share with you a little bit more of the science. So the science goes into this. They have some great research on what are called germ-free mice. I know that it's typically referred to as GF mice. So germ-free mice are bred to be essentially sterile. They have no bacteria in their gut. Now think about it. Humans have about 100 trillion bacteria in their gut. Well, there's about 30 to 40 trillion cells in your body. there is 3 times the amount of bacteria in your gut than there are cells in your body. Pretty amazing, right? Okay, so with all of that bacteria, which is, again, we know a lot about it, but we're still studying, right? So what they realized was that they have these germ-free mice that are basically bred to be sterile. They're kept in sterile cages. And then they stress tested these mice. They stress tested these mice against regular mice with normal gut bacteria. What they found is that these stressed mice produced more stress hormones and stress neurotransmitters. They produced more of the things like maybe dopamine or cortisol or norepinephrine, the stress hormones and neurotransmitters that you would produce under stress. Now, the normal bacteria mice put under the same stressful-based situations produce less of those things. The reason they produce less of those things is because the amount of neurotransmitters, especially, that are able to move into the circulation, into your bloodstream and make their way to the brain are done through gut bacteria as well. Pretty remarkable. And the signals from your gut and the bacteria in your gut travel very quickly, signal-wise, not bacteria, not neurotransmitter specifically, from the gut to the brain, telling you if things are safe or not safe. And again, vice versa. I found that to be pretty remarkable. I mean, that's, again, it's on mice, yes. However, a good study to start with, right? You're not going to create a sterile human being. That human being's not going to live very long, that's for sure. They won't have an immune system. Literally, they won't be able to fight anything off. So that's really, really important to look at. But I found something else to be very interesting. There's 2 additional studies. I think these are really important. So they found a bacteria that not all, again, I shouldn't say that. Children or infants are born with it in varying degrees, a bacteria called Bifidobacterium infantis. I've talked about this before. When a child is colicky, or they have digestive issues, sometimes there are 2 bacteria that are missing that are very, very important. We've used in my practice for many, many years. I know about this because I did quite a bit of research 10 years ago when my first daughter was born. And she didn't have enough, and again, so you can run around in circles to find out why. But regardless, she needed more of one bacteria called L-reuteri. All right, it's a bacteria that I've done a lot of study on. A lot of study. It's amazing, amazing bacteria for allergies, for immune system, etc. Anyway, you can, I should say this, children, or in this case, studies with mice as well, when they're given more of this Bifidobacterium infantis, they actually have a better reaction to stress. So pretty remarkable. L-reuteri, just the drops, certainly helped my daughter when I was able to do that research and kind of pull it all together a few months after she was born. So that was pretty fantastic. Now, again, please don't go out and just go buy Bifidobacterium infantis because you don't necessarily know that you need that. You actually need all the good bacteria in your gut. And a lot of that is actually lactobacilli. I won't go through that study as well, but that was a really important one. And then there's one more, because a lot of people keep asking me, should I do what's called, we'll just call it a fecal transplant. Okay, you can call it fecal microbiotic transplant or microbiota transplant, but it's basically taking the stool, because remember, 50% of the stool, your bowel movements, is bacteria. And you're taking that and you are essentially injecting it into another person with an imbalanced gut. The problem is you have to be really careful with that. And that's a conventional medicine mindset. Now, I know a lot of naturopathic doctors are getting into that. I respect it. I appreciate it. I think it's the last place to go, though, in my opinion. It's just my opinion. Okay, it's my opinion only. And the reason is that you need to exhaust your possibilities through natural-based health first, true natural-based health. And the reason is that have you assessed their entire gut microbiome, looking at the parasites, the bacteria, the yeast overgrowth, the H. pylori? Have you done something like the CBO protocol with the citricidal drops, which is a full 12 weeks? Like not 3 weeks, not 4 weeks to rebalance the gut. Like, let's be serious. It didn't happen overnight. It's going to take more than 3 or 4 weeks to rebalance gut. Now, you can get rid of your symptoms in 3 or 4 weeks. No doubt about that. We see that happen all the time. But it takes a little bit longer to rebalance 26 feet of essentially garden living in your stomach with, or living in your intestines with 26 feet of an intestinal tract. So again, I want to be serious about this as well, not treat this like, take you one pill and you're good to go. So it just takes some time. And you need to then, again, you're weeding the garden, then you're replanting it with good fruits and veggies, good produce, right? And that takes some time. So here's the thing though. There's a negative side effect to fecal transplants, and that's why I don't think it should be the first place that you go. The study actually found that transferring microbiota via fecal transplantation in some humans, those people that had depression and they took the bacteria from their gut, their microbiota, and they put it into another human, well, that other person actually got more anxious and depressive behavior. And this was actually done in rodents first as well. And they show that microbiome in humans as well. So I can link up these studies, and I'm happy to do that. But that's why I think we want to be careful. And that's because we are finding out more and more that the bacteria that live in our gut, it's a symbiotic-based relationship, meaning like we take care of them and they take care of us. And it's very interesting because it does seem to be somewhat interpersonal, meaning we have varying degrees. And that bacteria, which I've proven before, and I've shared the science on that, can help people lose weight. It can cause people to gain weight. Well, we've got new study, new research that shows that bacteria can cause some people to be more stressed, lower mood, more anxious and depressed. And so we have to be careful that if you're doing something like a fecal transplant, which again, last option in my opinion, you could take on some of the qualities, the actual feelings, emotions from that other person by taking that bacteria from another individual and putting it into your own. So again, I think we want to use that as our last resort. There's a time and place for everything. I just wanted to share this with you here today, just to at least get the wheels turning, that there is a direct connection between your digestive health and your mental health. And if we're not taking that into consideration, I don't think we're doing our very best for those people suffering from low mood, anxiety, depression, PTSD, and many other mental health-based imbalances. So hopefully this was helpful. Of course, you can always let me know if you have any additional questions or comments. I'm here to help. And for all of the show notes and the research studies, as well as previous podcasts on this topic, you can head on over to stephencabral.com/2322. Thanks so much, everyone. Take care. Have an amazing day. Did you know that the body really only becomes sick or imbalanced in only two ways? Over time, you become deficient in vital nutrients, and you also accumulate toxins internally and from the environment. As those nutrients diminish and you increase your total toxic load, your body then begins to show the first signs of dis-ease. It's actually quite predictable, and the good news is that if we know how you began to fill up that proverbial rain barrel, we also know how to empty it to begin the healing process. I was fortunate enough to learn this ancient healing process from my mentor after suffering from debilitating diseases for close to a decade. It was only when I began to implement these techniques did I finally overcome my illnesses and go on to live a life of energy and vitality that I now enjoy. I'd like to share with you now what I discovered after traveling all over the world and how to combine the best of ancient healing wisdom with state-of-the-art science. Allow me to teach you exactly how I've been able to help over 250,000 people to empty their rain barrel and begin to transform their body and lives into what they've always hoped they could be. To get your copy of the international bestseller, The Rain Barrel Effect, simply go to stephencabral.com/rainbarrel.